So the first set of special tests we're going to do are for instability at the elbow. For the valgus stress test, I'm going to have the patient's elbow flex between 20 and 30 degrees of flexion. And then I'm going to hold at the wrist here and apply a valgus force at the elbow. This would be positive if there's increased laxity compared to the other arm or if it reproduces pain. For the varus stress test, again, and 20-30 degrees of flexion and holding at the wrist here, and I'm going to apply a varus force at the elbow here. And again, this would be positive if there's increased laxity or if it reproduces pain. For the milking maneuver test, I'm going to have the patient's elbow flexed at 90 degrees of flexion. Their forearm's going to be supinated. I'm going to stabilize at the elbow, and I'm just going to pull this thumb down like that. So it applies a valgus force at the elbow, and that would be positive if it reproduces pain. For the moving valgus stress test, I'm going to abduct the patient's arm to 90, and I'm going to apply a valgus force at the elbow here, and I'm just going to move them from elbow flexion into extension. And this would be positive if it reproduces pain between 120 degrees of flexion and 70 degrees of flexion. The next set of special tests are for lateral epicondylitis. The first one is Cozen's test. So I'm just going to go ahead and have the patient put their wrist in extension here, and I'm going to have them just hold that position while I apply some resistance. And the next one is the Mills test, where I'm going to passively move the patient into wrist flexion and elbow extension. And the last one is Maudsley's test, where I have the patient's fingers extended here and apply some resistance at the middle finger here. They're supposed to hold it. Now, if any of these tests reproduce pain, then it would be a positive test. For the biceps squeeze test, I'm going to have the patient's arm in 60 to 80 degrees of elbow flexion and their arm slightly pronated. And I'm just going to go ahead and squeeze the biceps muscle belly from back here. And you should get a little bit of forearm supination. If you don't see that at all, then it's a positive test. The next set of special tests are for any neurological dysfunction. The first two are for cubital tunnel syndrome, and this one is called the elbow flexion test. So I'm just going to have my patient go ahead and depress their shoulders down. They're going to go ahead and flex their elbows as much as they can with that forearm supination, and then they're just going to go ahead and extend those wrists. And they would hold this here for about 3 minutes, anywhere between 3 to 5 minutes. And to make this test even more valuable, you can go ahead and abduct the arms here. And this test would be positive if there's any tingling or paresthesia running along that ulnar nerve distribution. The next test is Tinel's line. So I'm going to go ahead and grab the patient's elbow here. You can go ahead and relax. And I'm going to go ahead and find that space between the olecranon process and the medial epicondyle, and I'm just going to tap 6 times between there. And this would be positive if there's any tingling or paresthesia going along that ulnar nerve distribution. And this last test is a pinch grip test for anterior interosseous nerve. I'm going to go ahead and ask my patient to make an OK sign with their fingertips here, looking at the index and thumb. And it's negative for her because she goes tip to tip. Now, it would be positive if they started out at tip to tip, but then over time would go pulp to pulp, or if they just started out with pulp to pulp. So the special tests for carpal instability, the first one is the Watson or scaphoid shift test. You're going to start the patient's wrist out here. I'm going to palpate for the scaphoid, and they're going to start out in ulnar deviation and extension. As I'm applying the pressure on the scaphoid, I'm going to move them into wrist flexion and radial deviation. And this test would be positive if there's a clunk or if it reproduces pain. For the scapholunate shear, you're going to go ahead and palpate that scaphoid, and then you're going to go down to lunate. And you're just gonna grab hold of both of those bones and you're just gonna shear them anteriorly and posteriorly. And this test would be positive if there's excessive movement in that joint area there. For lunotriquetral shear, you're gonna go ahead and find lunate, and then triquetral or triquetrum, and you're just gonna go ahead and apply a force on those two bones to create a shear anteriorly and posteriorly, and this would be positive if there's excessive movement or if it reproduces pain. The next one is the Lichtman test or the midcarpal shift test. So you're going to go ahead and palpate just by capitate, and you're going to go ahead and axially load, and you're going to move them from radial deviation to ulnar deviation. And this test would be positive if you feel like the midcarpal shifting in that test or if it reproduces pain. The last one is the finger extension or the shuck test. So you're going to have the patient place their arm on the table like this. They're going to be in wrist flexion and MCP flexion. And all you're going to do is you're going to apply some resistance here and ask them to go ahead and extend their fingers. And this test would be positive if it reproduces pain. So these next special tests are for bone or joint integrity, and the first one is the thumb CMC grind test. So I'm going to go ahead and stabilize down here by the distal radius and the carpals, and I'm going to go ahead and take hold of the metacarpal here, and I'm just going to go ahead and load it and do some circumduction. And this would be positive if it reproduces their pain or if you feel like any clunking or anything like that. For the next one, there's a distal radius ulnar joint stress test. So all you're going to do here is you're going to go distal radial and ulna, and you're just going to go ahead and apply a shear here. And this would be positive if it reproduces any pain or if there might be some excessive movement. The next one is the piano key test. You're just going to go ahead and find the distal ulna here, and you're just going to press down. And again, this would be positive if it reproduces their pain. And the last one here is the UCL stress test. And you're going to go ahead and apply ElbowWrist force at the MCP of the thumb here. And this would be positive if there's beyond 30 degrees of movement. These next special tests are if you suspect a TFCC lesion. So the first one is the ulnomeniscal triquetral dorsal glide. So you're going to hold the patient's arm up like this. You're going to go ahead and palpate for a piece of form through here, and you're going to find the distal ulnar head here, and you're just going to go ahead and almost pinch to create a shear. And this would be positive if it reproduces their pain. The next one is a supination lift test. So you're just going to go ahead and have the patient bring their arms underneath the table like this and ask them to kind of almost try to lift their hands up into the table, but you want to make sure that they keep their wrists nice and straight and lift up with the elbows. Okay, and that would be positive if it reproduces any of their pain. The next one is the ulnar impaction test. So you're going to go ahead and feel for the 4th and 5th metacarpals here, and you're just going to go ahead and axially load that. And that would be positive if it reproduces their pain. The next one is a TFCC load test, and you're going to go ahead and palpate for that 4th and 5th metacarpal again. You're going to axially load, and then you're just going to go ahead and do some flexion and extension. And again, that would be positive if it reproduces their pain. For the press test, I'm going to go ahead and have the patient sit in a chair that has armrest. But since we currently don't have any chairs with armrests in the area, we just kind of makeshift our own here. So the patient's going to place their hands on the armrests here, and they're simply just going to go ahead and press up like they're about to stand. Yeah. And this would be positive if it reproduces their pain. So these next special tests are for any motion restriction in the fingers. The first one is the Bonnell-Littler test, where you're going to go ahead and extend the MCP and then flex the PIP joint. And if you see any limitations there, you don't know if it's whether it's coming from the joint or the muscle. So you're going to go ahead and flex the MCP and then again flex the PIP. Now, if you still feel any limitations in motion from that, then it's definitely a joint issue. The next one is the Haynes-Zancoli test. So you're going to go ahead and put the finger in neutral here, and then you're going to go ahead and flex the DIP. If you notice any limitation here, again, you don't know if it's coming from the joint or the muscles. And then you're going to go ahead and flex the PIP and then flex the DIP. And if you still know any limitations here, then it's definitely a joint issue. These next special tests are if you suspect a tendon or muscle injury. The first one is the Finkelstein test. So I'm going to go ahead and ask my patient if they can just go ahead and grab their thumb like this. And I'm going to go ahead and only deviate. And I'm going to do this slowly. And this would be positive if it reproduces any of their complaints of pain. The next one is the FDS test. So can you go ahead and put your palm up? I'm going to go ahead and stabilize all of the phalanges except for the third here. And I'm just going to go ahead and ask the patient if they can go ahead and just flex their finger like this. And I'm just going to go ahead and flick the distal phalange here just to double check that the FDP is on slack. And this would be positive if they wouldn't be able to flex that finger at all. The next one is the FDP test. So I'm going to go ahead and stabilize the finger here at the MCP and PIP joint. And I'm just going to go ahead and ask the patient to go ahead and flex their finger. Yeah. And this would be positive if they weren't able to move this distal portion of their phalange at all. And the last one is the integrity of extensor hood. So I'm going to have my patient just place their hand on the table like this, so where only their PIPs are flexing over the table. And then I'm going to come in and apply some resistance here and ask them to just kind of straighten out their fingers. All right. And this would be positive if they weren't able to apply any resistance on my hand while they're trying to extend. So these next tests are if you suspect carpal tunnel syndrome. The first one is called phalanx test. So you're just going to go ahead and have your patient put their hands down like this and bring them together, and they're going to hold this position for about 45 to 60 seconds, and this would be positive if it brings on any of their symptoms within that time. The next one is the hand elevation test. So you're going to ask your patient to bring their arms up and then bring their wrist down like this. And they're going to hold this for about 2 minutes. And this is positive if it reproduces any of their symptoms within those 2 minutes. The next one is a carpal compression test. So you're going to go ahead and have the patient place their arm on here, the arm supinated. You're going to go ahead and go over the median nerve. And you're going to use a thummy thumb, and you're just going to compress it here. And you're going to hold it for 30 seconds. And this would be positive if it reproduces any of their symptoms. The next test is the reverse phalanx test. So you're just going to ask your patient to kind of put their hands like they're praying and have them bring it down a little bit. And they're going to hold this position for about 60 seconds, and it'd be positive if it reproduces their symptoms. And the last one is the Tinel sign. So you're going to go ahead and have the patient place their arm on the table, and you're going to go right over that median nerve and just tap on it 6 times. And that would be positive if it reproduces any of their symptoms. So if you suspect an ulnar nerve lesion, you could do the Froment sign. So you can grab a piece of paper, ask the patient to put their thumb and index finger like this into a lateral grasp, and you're going to ask them to hold onto this piece of paper while you try to pull it out from their hand. Now this would be positive if you could easily pull the paper out from their hand, or if you see them kind of flex that IP joint on the thumb. So if you suspect a vascular issue with the patient's hand, you can go ahead and do the Allen test. So you're going to have the patient lay their arm with the palm up. You're going to go ahead and palpate for those arteries on either side of the forearm here. And you're going to go ahead and ask your patient if they can open and close their fists 3 times. And on the last one, just hold your fist there. And I'm going to go ahead and compress on the arteries. And then can you go ahead and relax your hand? And I'm just going to go ahead and release one of them. And you should see their color coming back on that side of the hand. And then we're going to go ahead and reset. So go ahead and open and close your hand 3 times. And on the last time, keep it closed. And I'm going to compress in those arteries. But this time I'm going to let go of the other artery. So can you relax your hands? And I'm going to release. And you should see the coloring come back on their hand on that side. And it would be positive if you didn't see that return of blood flow to that area.